Well, we've got a number of healthcare problems here in the state of California. We've got about 6.5 million people who are uninsured in the state of California. Not only is that a tragedy for those individuals because they let small medical problems become big medical problems, but then they go into the emergency room, probably the most expensive place to get health care and inefficient, and it puts a severe financial burden on the entire healthcare system. Besides that, we have healthcare costs that are going up for everybody at double-digit rates. Back in 2004, the average cost for a family of four here in California was $10,000, and if it continues to go up at double-digit rates, we're potentially looking at $20,000 for a family of four in the year 2010. So this is a real crisis that we need to address. Here in California, Assemblyman Nation and I propose that everybody in California ought to be required at least to have a basic insurance policy. It could be provided by the individual, by their work, whatever, but everybody ought to have medical insurance just like everybody ought to have auto insurance. We also provided for purchasing pools or purchasing exchanges so small businesses and individuals could buy more affordable insurance just like large businesses, and recognizing that low-income individuals would have a problem affording insurance no matter what, we felt it was important to provide a subsidy for low-income individuals, a subsidy where there was a component paid for by the state, partly by the federal government with federal funds to the extent that they're available, and also paid for by the employer or the employee. Well, since World War II, we have had a model based upon the employer footing the bill, but the problem is now fewer and fewer employers every single year are offering health insurance. As the costs go up and companies are dropping their insurance, or if they're not dropping their insurance, they're certainly dropping the benefits that they offer. Not only that, with an employer-based system, we have lots of other problems. People get locked into their job because they don't want to move from one job to another because of concerns about health insurance. If we have purchasing exchanges or purchasing pools where people can get affordable insurance and move from one job to the next and keep their insurance, not having to change it, that would be an important plus for individuals. Most of the adults who are uninsured here in the state of California, they're not living off the government dole. These are individuals who overwhelmingly are working. In fact, about 80% of the uninsured are working or are children whose parents are working, and typically they're working in small businesses and low-income jobs. Well, the largest single group of the uninsured are the young invincibles. Those are the 18 to 35-year-olds who think that they're never going to get hurt or never need health insurance or medical care. And in fact, interestingly enough, other than pregnancy, the highest cost of medical care for those individuals is related to trauma. Automobile accidents, motorcycle accidents, or other related trauma. And so those individuals think, well, they don't need health insurance. If they get involved in some traumatic accident, they're simply going to be picked up by the paramedics and brought into the emergency room and be taken care of. And to some degree, they're right. The problem is we're all paying for that. And so if, in fact, you're going to address the problems that we face here in California, if you're going to make it so everybody can get affordable insurance, you have to have all those people who are healthy as part of the insurance pool. They've got to be in the insurance pool so that you don't just have the sick people who are left who are buying insurance and drive up the costs for those people. By bringing in young, healthy people, requiring them to be part of the pool, it brings down the cost for everybody. Here in California, we've sent back over the last number of years, every single year, about $750 million that could have been used to help cover the uninsured. In fact, a number of years ago, the federal government gave a waiver to the state of California that said we could go ahead and cover the parents of children who are in the Healthy Families Program. We've not yet implemented that program, so we've already gotten approval from the federal government to help cover the parents of those children that are enrolled in the Healthy Families Program, and we've just not implemented that here in the state of California. That, in fact, would be a big step in helping to address the number of uninsured people here in the state of California. We haven't implemented it not only because of the partisan gridlock here in the legislature, but because it's going to require the state to pay for some of this care. The interesting thing is that for all of the children who are uninsured here in the state of California. The estimates are that because we get federal matching funds, both under the Medi-Cal program and the Healthy Family program, that to cover all of the uninsured children here in the state of California would cost about $330 million total for state money. To put that in perspective, statewide now for the Medi-Cal program alone, we're spending more than $1.5 billion just on administrative costs. And so if we could do a better job on administration, make things more efficient, improve our administrative services, and save a little bit of money, we would surely have enough money to cover all of the kids here in California who are already eligible for Medi-Cal or Healthy Families. Well, interestingly enough, prescription drugs are something that need to be addressed, but overall prescription drugs make up about 10% of the healthcare dollar. And so if in fact we're going to address our healthcare problem, we need to address it in a more global sense. If you just address prescription drugs alone, you're not going to answer healthcare costs as well as you could otherwise. You know, I was very pleased that Massachusetts passed their proposal. I think not only was it a proposal that was very similar to the one that Assemblyman Nation and I introduced here in California, but it showed that the political process can work. Clearly their political process in Massachusetts is working much better than our representative democracy here in California. Here in the legislature in California, it's very dysfunctional. It's in partisan gridlock, and the legislature has not been able to address the problems of health care, the various problems of access, cost, and quality. In fact, the legislature largely has not been able to address any of the problems that the state of California faces. And so the main issue that's getting in the way of health care reform here in California is political dysfunction, partisan dysfunction here in the legislature. Legislators are unwilling to work together. They're unwilling to compromise. They're unwilling to come up with common sense solutions like they did in Massachusetts. Here, legislators are only willing to abide by the agendas of the special interest groups. 100%. They're unwilling to break out of the agendas set by the special interest groups, whether you're talking about the public employee unions, the health insurance companies, or any of the other myriad special interest groups that have an interest in healthcare reform. And so if in fact we're going to get a solution to the healthcare crisis that we face, people are going to have to compromise. They're going to have to work together to come up with common sense solutions rather than just continuing the partisan gridlock and partisan dysfunction that exists here in Sacramento. You know, there's a lot of concerns how we're going to pay for this. Now, the fact of the matter is we're already spending billions of dollars here in California to support the safety net, to support the emergency rooms, the public clinics, and all those places where individuals who lack health insurance now are going to get their medical care. And so what Massachusetts did, in fact, was they said, look, let's try and spend that money a little bit better. Let's gradually shift money from the safety net, from the hospital emergency rooms and from the clinics, and help those individuals get insurance. That's what Massachusetts is doing, and we can do the same thing here in California.